So as many of you know, I'm a big champion of trying testosterone propionate as skincare in clinic. But many of you, even if you've seen the original video that I made, you may not know that I am not the only one doing this, and there are actually a lot of people all around the world doing the same thing. So what I thought I would do is I would speak to someone else who's also doing that. So with me all the way from NY Skin Clinic is Elaine Wood. Elaine, thank you so much for joining me today and being the star of the show for today. What I'd like to do is basically talk about the good and the bad. I think it's important we're balanced, and when we have conversations with patients, typically we are talking about the benefits and the risks. And I think there are risks with using this. So I thought maybe we could talk about both today with two different clinical perspectives so that people can see, is it something they want to try? Is it something they want to avoid as well? So I think you've been using it yourself. Is that right?
Yes, that's right. Since January, middle of January,
Perfect.
I started using it. Yeah.
And in your own experience, I don't want to put words in your mouth. How have you found it? You've got a lot of clinical experience. What do you think of it?
Yeah. Well, I've obviously got a skin clinic, so I'm all about skin and look after my skin. Used to use Zero Skin Health, but since I started using it, I would say it took 6 weeks
Yeah.
till I started noticing results. But my skin just feels clearer. I mean, I didn't have overly a lot of lines and wrinkles in my face. But I've just noticed it's smoother and better and
Nice.
brighter.
And what about your patients? What have you had any feedback, good or bad? Let's talk about both.
Yes, yes. A lot of my patients, I would say, are just starting on it because, as I said to you, Abs, that I wanted to just trial it, and I was on a lot of different things, so I came off them all. I'm still using the MZO exfoliating cleanser and polish, and then I've just been using the TP along with the powder that you recommended.
Cool.
And so I did a bit like a case study, really. So before I give anything to my patients, I like to just try and test it myself. So I'm very much in that stage of telling them how great my skin is. And just last week, I had two clients that came in and says, "You look like you're 24." So I think because they're actually noticing my skin. So many of my clients have been in and saying, "Elaine, what are you doing?
Yeah.
You really look good. Your skin's amazing." And I says, "Well, the only thing I'm doing different is this TP cream."
Nice, nice. And I think, um, so what about the negative side? Because I do want to talk about both. In your experience, at least in the patients that have been using it, for you and them, have we seen any acne at all?
No, I mean, I wouldn't. I don't know if it's something that I would prescribe for someone that has acne because I really want to get their acne under control first. So it's much more for a lot of the aging concerns that are coming in that I've been recommending it for. But I think once someone's acne cleared up, I would have no hesitation in getting them onto that as well.
Yeah, I mean, I'm the same. I personally believe that if they have acne to start with, doing this could potentially make it worse. And for that
Yeah.
reason, I always recommend this is not if you've got any skin condition whatsoever, acne, psoriasis, eczema, cold sores, you name it. It's not for anything. It is really just for,
Yeah.
loss of elastic fibers, loss of skin thickness, all those kind of things. So in your experience in the patients that have used it,
Mhm.
have any of you, your patients or yourself who didn't have acne to start with then develop any, or has it kind of just been as it was to start with?
No, absolutely not. I mean, I've always been prone to the odd outbreak, and I definitely have not had any outbreaks at all since I've been on
Cool.
it. So I wouldn't have a problem giving that to people, if they were concerned about that.
Cool.
I mean, I think one of the biggest things that people will say about it is, oh, am I going to develop hair on my face because of the testosterone aspect? But I would say that has definitely not been an issue at all. I definitely don't have a hairy face.
Good, good. I'm glad. I mean, yeah, that was going to be something I asked you about, and it's interesting that you said, you've not had it. Obviously, your patients haven't had it. I've not had it, and none of my patients have had it as well. But in the interest of trying to be scientific, I'd like to say that that doesn't mean that no one will get it. It may be that there will be someone in the future that might end up with something like that, and we don't know yet. It could be that an existing patient of mine or yours has had it, but they haven't said anything. That's possible as well. So, it is possible, theoretically at least, and I've never hidden that. I've even shown pictures of it, even in the first video that I made about it. But in terms of fighting it, my advice to people is, if you're someone that's had laser hair removal, I mean, there's nothing to grow, so nothing's going to happen. If you're someone that regularly removes the hair in some way, electrolysis, waxing, you name it, then again, you've got nothing to worry about, I believe, because you're constantly getting rid of anything that pops up anyway. So there's nothing to worry about there. But it is something to worry about. Now, the other kind of possible negative side, which I think is important to mention, some people are worried that it affects their body, i.e. their internal level of testosterone. Now, I've got patients who have sent their blood work, and I've actually put that in an update video as well, showing that even after a long-term use, it's actually made no difference. And certainly in the initial study, it was shown that it only affected the area where the skin was placed and nowhere else. However, I do want to point out to people that I think one or two people who I have treated, they said, oh, I think it might be affecting me. And what's tricky in those situations is I believe both those patients were on HRT, hormone replacement therapy. So it's a little bit difficult to actually say, is it that, is it this, is it something else, especially when no one else has actually had any changes. Do you, at least in your experience, or any of the patients that you've worked with, do you feel as though you've noticed anything systemic coming on at all?
Well, in my own experience, I mean, I was on testosterone for HRT replacement, which I came off probably around about the same time. Now, I've never been prone to facial hair at all, but when I was on that testosterone, I did get some. Just round about my lips, I noticed that with testosterone. But I've been off that probably about 6 to 8 weeks, and I've been on the cream since then as well, and it's definitely less now. I don't know if you've heard of dermaplaning, when you get the blade and just take all that vellus fluff off. And my esthetician was doing that on me the other day. She says, Elaine, you've got less fluff facial hair here than you did before. And she wasn't thinking about the cream or anything like that. And I thought that was interesting. And I mean, the patients I've given it to, I mean, so far, there doesn't seem to be any issue as well. But it might be interesting to see people that are on HRT and as well.
That's interesting. I mean, that's a really useful bit of feedback, actually, that, you've got something to compare to. And even on HRT, you've got something to compare to, and you've stopped it, and you've got less of the same symptoms. So I think that's really scientifically interesting, because it shows that it's not really having the same effect as HRT or anything like that, which is nice. Yeah, I think it's nice to have another clinician that's doing it. Can you tell people your website and how to get in touch? Because it's important that they realize I'm not biased in recommending this cream, because you don't have to get it from me. You can get it from anyone. And I don't make anything from it if you do that. So how do people get in touch with you if they wanted to have you treat them as well?
So it's NY Skin Clinic, which is in Aberdeen, Scotland, and our Facebook and Instagram page is just at NY Skin Clinic. And that's very. I mean, I'd be so happy to recommend that to any. And a lot of my patients that are coming in, I also give them the link to your YouTube page so they can listen to the science and all the details behind it as well. Because as I said before, I give this to you, go and listen to this first, and then come back, and then we'll get it prescribed.
Cool. I mean, that's really good
The
informed
doctor
consent.
have a very familiar in clinic.
Well, I mean, if typically in an appointment we don't have like 3 hours to talk about stuff, right? So if there's a 45-minute video really detailing things, I think that allows us to obtain informed consent much better, which I think is not a bad idea.
Yeah.
But I do want to balance things a little bit, because I want people to know there is a good and a bad side. What would you say is the worst thing about the cream, or what's been the worst reported feedback that you've had on it from anyone?
Well, there isn't any. I mean, as I would say, people are concerned with the facial hair, but no, it's great. I've also I've given it to more men, interestingly, than women, and the two men I've given it to. I mean, one of them in a few days noticed the difference,
Wow.
and another one had open pores, enlarged open pores, and his skin just looked slightly grey. And all of a sudden, his skin's just got so much colour in it, and the pores have reduced in size as well.
Fantastic.
Yeah, and he looks younger too.
Amazing. I mean, for me, I would say the worst thing is that there are quite a few patients who are very slow to respond. It might even take several months for them to really start to get enough into the skin and really notice a difference. There have been patients like yourself who've noticed things very quickly, but very openly, I'll say there's people that have taken a long time. Some people, even after a few months, they say, "Do you know what, I'm not really noticing anything," and that's fair enough. Because I think with any skincare, any food, any treatment, there's always going to be some people that don't get on with it, and I don't think that's any different here. But it's nice to get your feedback too.
Yeah. I mean, I've been using it probably 2-3 times a day, like you suggested. And I suppose the other side is the price. It is quite pricey
Exactly.
for some people. And, at that price, you'll probably find that people all use it maybe once a day just to make it last.
Yeah, that's true.
That probably is biggest. Yeah.
Yeah, I think price is another negative. But I think also as more and more people use it, obviously you're using it in a different country. I know other people overseas that are using it as well. I think as it becomes more used, it should hopefully come down over time as we talk about it and show people that it's something you can do. But yeah, I think that's been good. Talking about the good side, talking about the bad side, a few little examples and your personal example as well. Thank you so much for your time. We know how to get a hold of you if you want to see your work, your website and your Instagram. So hopefully we'll hear many more stories in the future. Thanks a lot for joining me, Elaine.
Oh, it's my pleasure.